Hi guys, I'm so super excited to talk to you about OB-GYN as a career. My name is Dr. Mona Hardas. I am a practicing OB-GYN in Flint, Michigan for over 20 years now. So what is an OB-GYN? Obstetrics and gynecologist is a specialty which encompasses a lot of things. So obstetrician basically takes care of women who are planning to get pregnant, who are pregnant, deliver babies, and also take care of the patients after the babies are born. Gynecologist, on the other hand, will take care of patients with a wide variety of symptoms or problems. The age range for our patient could be from, say, age 12 or 13 to 90 years. And with a variety of different problems, which could be infections, abnormal bleeding, abnormal pap smears, tumors, cysts, so many different things which brings a woman to see an OB-GYN. For some of my patients, I'm their only primary care provider. That's the only doctor they ever see because they are healthy, they don't have any problems, and then they say, hey, I don't need to see anybody but just you. So this is the part of the OB-GYN, the primary care, which attracted me. I have always been very passionate about women's health, and I can address the women's health issues through my practice of OB-GYN. So what do you need to do to be an OB-GYN? So after your medical school, you do a residency training for about 4 years. I know, it seems long, doesn't it? 4 years seems so long. But because the scope of practice is so much, trust me, you need that time. You need that to learn different aspects of women's health, but also your surgeries too. So traditionally, the way this is divided is first year of your residency, you end up doing majority of the time just the primary care and a little bit of an obstetrics. Second year is very highly OB. So you learn to do C-sections, deliver babies, and do all surgeries involved with the pregnancy care. Third year is usually different subspecialty training and a gynecology-based practice and learning, obviously. The fourth year of your residency, you start doing your surgeries independently, of course under some supervision, and also do a lot of administrative work. So 20 years ago, if you had asked me that if I knew that this is a right career choice for me, my answer to you would have been, I don't know. You know, as a medical student, when you start your clinical rotations, everything is so exciting and everything is so interesting that you like everything you see. And it's very hard to decide what you want to do, which way you want to go. It's the hardest decision of your life. But you have to take a leap of faith, right? You have to kind of decide to yourself what attracts you more. And to me, the combination I told you about the primary care and a surgery is what attracted me to the OB-GYN specialty. And it has turned out to be the right choice. So when I went in OB-GYN, it was a very male-dominated specialty. The working hours were long, and people were worried about getting in this specialty because of the malpractice associated with it. Over the years, in last 20 years, I have seen the specialty has evolved in a good way, that now you literally can pick and choose how many hours you want to work. And that's wonderful, especially for women who are going in this field. And mind you, this field is attracting more and more women because it's a women's health issues as well, and flexible working hours now. So for example, when I went into practice, I was a part of a small group. We were 3 of us. So I was on call every third night. But now you can join a big group practice where you could be on call every 7 to 10 days, which is not bad at all. Or you could join a hospital-based group where you can just decide to do office-based practice and no on-calls at all. So if you decide to do extra on-calls, then the hospital will pay you extra money if that's the route you want to go. But if you don't want to, that's fine too. There are certain hospital-based groups where you could work just as a laborist. Now, what is a laborist? It's a new definition now. So the laborist is a person who stays on labor and delivery and during his or her shift will deliver the babies, and that's it. So once your shift is done, you're done. You don't have a pager. You're not responsible for any other extra calls. And you would work only, I think, about 2 weeks a month. So you get quite a bit of an extra time off. So it's going to be great for people with the young families. You can pursue your dream, plus have time with your family, or time to travel, trying to pursue any hobbies or interests. I had three kids, 3 daughters, and I love workout, exercising, outdoor hiking, biking, traveling. I love it. I love to paint. I love to read. So to balance all that, balance my family and balance my interest and a work used to be a little bit difficult, but over the time it's getting much easier just because of the changes and the way people are looking at the specialty. People are not saying, oh, look at her, she has taken so much time off. No, everybody's doing it. So it's a new norm in our specialty right now. So if you want to work as a general OB-GYN, these are the choices I told you about. But of course, you can also do a specialty training, a subspecialty training. Now, there are different fellowships available in OB-GYN. One of it is called MFM, or maternal-fetal medicine, where it's a 3-year fellowship where you concentrate on learning about high-risk pregnancy. So you're a consultant for a high-risk pregnancy cases. There is a fellowship for REI, or reproductive endocrine, which is basically learning about infertility and its management. So you learn about IVF and different treatments. Again, 3-year fellowship, as I told you. GYN oncology is another fellowship where, again, 3 years, and you basically learn about cancer management surgeries. There is also, urogynecology training program for 3 years, where you learn about more pelvic surgeries and concentrate on female urological work. And there's a 1-year fellowship in minimally invasive surgery, where you learn about laparoscopic surgery. But when you are training as an OB-GYN in your residency training, you get a lot of training on minimally invasive surgeries. I do gynecology only, and my gynecological surgeries could be or are open surgeries, which are traditional open hysterectomies, removal of the cyst, tumors, that kind of surgeries, but a lot of laparoscopic surgeries, because it's more and more minimally invasive right now. I do a lot of robotic surgeries. Most of my hysterectomies are robotic hysterectomies, and it's fun to be able to use that technology. It's great for patients because after laparoscopic or robotically assisted laparoscopic surgery, the patient will either go home the same day, even after hysterectomy, or say just the overnight. She has got a smaller incision. She goes back to work in 2 weeks. It's very rewarding to be able to do that. You do learn that in your training, but if you want to learn more and specialize more, then you can do that 1-year fellowship program. You can also train in family planning and concentrate. It's, I think, 1-year fellowship and concentrate on that. Practice just the family planning and be a consultant for that. Currently I am doing more cosmetic gynecology and cosmetic surgery. Now, cosmetic surgery in gynecology is a very upcoming, very exciting field. And there are a lot of training courses available, but we don't have any official fellowship yet. I didn't say yet because I'm pretty sure that's coming. And I'm pretty sure by the time you guys are applying for fellowship, it's going to be there. Because of the word cosmetics, it's not a insurance covered surgery at this time. So it's basically out of the pocket cost for the patient. But there is a lot of awareness and a lot of demand. And I'm very excited. I'm doing it for the last about 5 years or so. And I'm going more and more toward that route just because it's something new, it's something exciting. I have done OB-GYN for 20 years. I wanted something new, something I can learn and practice. And this has given me an avenue to go that way. So it's exciting. I'm excited. My patients are excited. And it just gives you like that little new leash in life. It's like, okay, let's learn something, let's do something new. So see, there are so many new ways you can practice OB-GYN. It's not that traditional route there. There are lots of different areas that could be your niche, and you can just practice that. So when you go through your training and you like OB-GYN, then go for it. Jump into it, do it. If your heart tells you, just do it. Listen to your heart. Don't listen to people who are giving you negative advice or trying to talk you out of it. It's not for them, it's for you. You're doing it for yourself. And see, if you do something which you love, you're gonna be so happy. But if you don't like it, you're going to be so miserable. So, and you know what? Don't get scared or don't get put off by the malpractice lawyers too. I'll tell you one thing. If you practice good medicine, if you have a good heart, and if you don't do anything to harm your patient, you're going to be okay. Your patients are human beings. They know you. Once you form that bond between you and your patient, they understand you and they will be on your side. They will not be against you. So don't get put off by all these stories you see or the commercials you see on the TV. I would tell you, medicine is not a career choice. Medicine is life. And now that you have decided to go into medicine and this is what you're passionate about, please go for it. Now, if you need any more information about OB-GYN as a career choice or anything more, I know I just kind of touch base on little things here and there, but if you need any more information, please contact me. Follow me on Instagram. My Instagram handle is GlamGyno. You'll find my contact information there, so you can either DM me or you can email me, and I'll be really happy to help you or give you more information. So good luck for the future. I know it's a long road ahead of you, but don't be put off by that. It's worth it. It's just keep doing it, keep going at it, and you'll achieve your goals. So good luck and goodbye.